coming towards the end of my ST5 year in Obs and Gynae, I theoretically had 2 years to go potentially until I was going to be a consultant, and I didn't really have a great understanding about how to be a leader, how to manage people. And I think when I've spoken to people that have gone into that consultant role, they've said they weren't prepared for it, and this was an opportunity to take a year out and sit back and think about what kind of leader I want to be, what kind of leader I can be. And I think it's really useful to be able to kind of take a step back from training and understand a bit more about why things happen, why we make changes, and what the basis is for improvement. And as I've gone along, I've done audits and I've kind of presented those audits and said this is what we should think about changing, but haven't ever really got to the next step of implementing change and testing whether that change has actually made any difference. And I think it's a really good opportunity to learn more about it. So what kind of projects do you think you've learnt most from?
One of the things I've realised is that you can have a leadership role whatever position you're in. So, and depending on the circumstance, there will be some times where you're the leader, sometimes where you're not. I've grown more confident and I would feel happier to approach people who maybe I would feel that I hadn't seen before. So whether that might be kind of, you know, board members or the medical director or chief nurse and people like that, that within the organisation can help to affect change, but we sometimes don't always see when we're in our clinical roles.
It's not easy to make a sudden big change, and it's about small incremental steps. And it's about looking at the culture within teams as well, and how they work together and what they understand about processes and the reasons why they do things. And it's having an understanding about harm to patients and an understanding about how to promote safety. And some of the work that I've been doing with frontline teams, it's been really interesting to speak to members of staff and to understand what they think about patient safety and how they think that they can impact that. And some of the work that's been going on with falls, as I've seen some of the staff that I've worked with initially, there's a thought that patients in hospital are just going to fall, and there are some you're never going to be able to prevent, and actually it's that over the course of time that attitude changes and becomes well, nobody should fall, and we can absolutely do something about every person that's falling. And it's just a kind of turnaround in terms of in their approach to the problem. I think it's really rewarding when you get to speak to the staff working on the ward, and there's that change in their perception about things. I think during this year I'm learning more about how to engage staff. I think it's made me a lot more confident in what I'm doing, and I'm really looking forward to going back and being able to give some of the knowledge that I've learned this year back to the trainees that I'm working with, and hopefully inspire them to do something similar, because I think it's made such a difference to the way that I see my career.